What every woman should know about breast cancer, question and answer. Breast cancer remains one of the most common cancers affecting women today. But how much do you really know about it? In today's video, we'll be answering some of the most common and important questions people ask about breast cancer. We would start by explaining what the breast is made of. The breast is made up of fat, ducts, lobules, blood vessels and lymph vessels. The lobules produce the milk, which is then carried by small tubes, ducts, into about 12 to 15 bigger tubes, ducts, which open into the surface through the nipple. Both breasts in women are usually unequal and even the sizes vary with the period of the monthly cycle. They are a bit bigger and slightly painful about a week to the menstrual period. The breast has its share of blood vessels and lymph vessels. While everyone hears about blood vessels, only a few really hear about lymph vessels, but they are very important. They form part of the system in the body that fights against all forms of diseases including cancer. The lymph vessels carry lymph, which is a clear fluid, from the breast tissue to lymph nodes in the armpit, and these nodes could become swollen when there is an infection or cancer involving the breast. Question 1. What is breast cancer? Most breast cancers result from abnormal growth of cells of the lobules and ducts. In a few cases, the abnormal growth may be from the fat and connective tissue. The cells in our breasts, like in other parts of the body, are always replacing themselves, new cells being produced as the old ones die off. This is done in a balanced way by genes within the cells. However, this balancing mechanism can fail, resulting in more cells being produced than required, resulting in a swelling or tumor. If the cells are normal and do not destroy other organs around them, then the tumor is not harmful and not cancerous. However, if the cells are abnormal and invade nearby organs, then the tumor is cancerous. Question 2. How common is breast cancer? Breast cancer is the commonest cancer in women, with over 1 million women developing breast cancer worldwide every year. It also affects men. The number is quite small compared to women. In the developed world, where records are better kept, 1 in 9 women is likely to develop breast cancer in her lifetime. Question 3. What causes breast cancer? While it is known that most breast cancers result from the abnormal growth of the cells of the breast lobules, the parts of the breast that produce milk, the exact cause of such cancers is not known. However, there are several risk factors associated with breast cancer. A risk factor is something that increases one's chance of developing a disease. The risks of developing breast cancer include gender, mostly in women. The occurrence in men is very low. Age affects women older than 55 years more. Cancer in one breast increases probability of developing cancer in the other breast. Heredity risk is higher if certain bad genes are inherited from mother. Family history of breast cancer risk increases if grandmother, mother or sister had breast cancer. Lack of breastfeeding. Age of first delivery risk increases with age. Early onset of menstruation. Late onset of menopause. Race less common in black women. Use of hormones for a long time for treatment. Use of oral contraceptives for a long time. Heavy alcohol consumption. Smoking. Exposure to radiation from previous treatment for cancer in one breast or other sources, and exposure to certain chemicals. Question 4. How can I prevent breast cancer? Breast cancer can be prevented in the following ways: healthy diet rich in fruits and vegetables with minimal fat intake, regular exercise, moderate alcohol intake, no smoking, maintaining appropriate weight, use of estrogen-binding drugs and removal of the breasts. Question 5. When do I get screened for breast cancer? Women aged above 40 years are advised to do screening by mammogram every 3 years, but it is okay at 50 years and above. The exposure to X-ray is quite harmless and it helps to pick up breast cancer very early. Question 6. What are the benefits of screening? The benefits of screening include early detection and treatment. Several lives are saved yearly through screening. Question 7. Is there any relationship between breastfeeding and breast cancer? There is a slight advantage in breastfeeding a baby. This advantage is more in women who breastfed at an early age and for a long time. They are less likely to develop breast cancer. Breast cancer is not a death sentence. Early detection saves lives. Make it a habit to examine your breast regularly and visit your doctor for checkups. The earlier it's found, the better the chance of successful treatment. Don't forget to subscribe, like, comment, and share.